Okay. Hi, my name is Theresa Chen, and I'm from Hopkins University, and my study was looking at the longitudinal changes in hematocrit in hypertensive chronic kidney disease. And the reason why we were interested in this study was because anemia is common in chronic kidney diseases, and studies have shown that there's an association between lower eGFRs and increased risk for anemia, but these studies have been cross-sectional in nature, and so they limit our ability to see how hematocrit changes in the context of CKD progression. What we did was we looked at data from the African American Study of Kidney Disease and Hypertension trial, which was a 3x2 factorial trial, followed by a cohort phase. We wanted to see whether or not there were greater declines in hematocrit per unit change in eGFR. Adjusting for time. Our analysis consisted of mixed effects models with the use of splines to explore for nonlinear effects, and then we also performed stratified analyses with interaction terms to see if there was any kind of effect modification by gender or baseline proteinuria. And as you can see, can I point or? Sorry. So as you can see here, looking at just the cross-sectional association between hematocrit and eGFR at baseline, approximately at an eGFR of 40, that association becomes a little steeper. And when we looked at the longitudinal relationship, we found that those who started with lower baseline eGFRs had greater declines in hematocrit per unit change in eGFR than those who started with higher eGFRs, and this is reflected in the graph over here. In terms of effect modification, we found that even though women start off with lower initial hematocrits, men actually had greater declines in hematocrit per unit change in eGFR when their starting eGFR was less than 40. And those with baseline proteinuria, they had greater declines in hematocrit per unit change in eGFR if their starting eGFR was greater than 40. We also looked to see whether or not ACE inhibitors were associated with a greater decline in hematocrit, and there appeared to be no association with that. So I think our study is important because it characterizes how hematocrit changes as eGFR declines in chronic kidney disease, and suggests that guidelines for anemia should be perhaps more individualized in individuals who start off with lower initial hematocrits, men, and those with baseline proteinuria. So.